Welcome to Issues and Answers with Diane Kinderwater. Issues and Answers is presented as a public service to inform, educate, and better the lives of New Mexicans. And now, Issues and Answers with your host, Diane Kinderwater.
Welcome to the program. I'm Diane Kinderwater. Doctor, what is the pulse of our patient? What is the pulse of the medical field in New Mexico? I think, doctor, we're losing the patient. They're running across the border. They're running for their lives. What do we need to do to resuscitate our medical delivery system in New Mexico? What are our challenges? Well, Jerry Harrison and Melissa Candelaria have the answers there with the New Mexico Health Resources, and they are going to tell us how we're going to resuscitate our patient. And that patient is doctors, physicians, medical practitioners all across our state are needed, and we're going to find out why we have the challenges. Why aren't they in our beautiful New Mexico, the place that we call home, the place that we enjoy? Why don't we have medical professionals here? We're going to find out why right after this. Well, this is the second part in a series regarding medical professionals and the need for medical care in our state. You know it and I know it. You try to call and find an appointment. It's very, very difficult to get in most cases, not only here in the metro area, but of course throughout New Mexico, throughout the rural areas. It's hard to find them, and I've learned from Jerry Harrison and Melissa Candelaria from our last program that usually they're a resource center, a clearinghouse to find these physicians and medical professionals. And usually they might have about 300 openings, 300 slots they need to fill. Well, it's over 800 now. Jerry, what's going on? You've been in business here as a nonprofit, the business since 1981. And as some people say, aren't you doing your job? Why do we have over 800 slots to fill?
Well, Diane, one of the things that's changed is, for example, I got old in the last 30 years.
Okay.
And for decades, the health professionals in New Mexico had the oldest ages. And for decades, although it's changed a little bit, the proportion of physicians over the age of 60 in New Mexico was way beyond the other states. We were always number one in the oldest practitioners.
We were number one in something, having the oldest practitioner still practicing.
And
wow.
We were also number one in the reverse of having the fewest physicians under the age of 40. Well, the baby boom generation decided to age. And they decided...
They didn't die off, huh?
Only one died off.
And
they retired, or in rural New Mexico, sometimes those physicians would work at virtually no pay to be able to support their communities and support their staff in keeping their practice open when they probably should have retired.
Wow. What did you heard? Did you ever meet them as well, Melissa?
Not as much, no.
Okay. Mm-hmm. So back to you and your story. You talked to some of these, you met them through the years?
Yes.
Tell me what their stories were.
I remember a legislator that lived in Roswell some years ago, and his father had a life-threatening illness, and he could not find a physician in Roswell. And he asked, what can we do? And I said, well, in Artesia, there is a physician who might be able to see your father. And this was a hospital case, and had to move his father from one hospital to the next. The physician turned out to be an international medical graduate who stayed with his father for 24 hours in the hospital that no physician in southeastern New Mexico would do. And this legislator was so grateful to this physician that it filled an immediate need, but then he became a champion for issues that came before the legislature and recognized that there was a need to find people to practice in all of our communities.
And that's, of course, what you do at New Mexico Medical Resource, is find people for these slots. But it's difficult, as I said at the beginning of the show. It used to be 30, maybe 300 would be the average to find, but now it's over 800. And that's just the people you serve. You serve clinics. Who do you serve?
We serve community health centers, rural health clinics, community access hospitals, rural
What's a
hospital.
community access hospital?
It's a hospital with 25 beds or less. Basically,
Okay.
that's kind of the short story.
So what medical facilities doesn't use your resources?
I don't know. We have some private practice docs that call us and ask us if we can help them, whether it's find a dentist or nurse practitioner. We recently had an orthopedic place here in Albuquerque. I met them at the Roundhouse on Primary Care Day, asked if we could help them, find a nurse practitioner or a physician assistant. So.
But like UNM, Presbyterian, do they need your services?
Absolutely.
Oh, they do.
In fact, UNM and Press, and then the old Lovelace, you've been around long enough to remember the old Lovelace healthcare system, they founded us. And they saw that there was a need throughout the state. And so we've worked with almost everyone. And we're open, again, dependent upon their need. They may disappear for a year or 2 years or 3 years. They always come back.
And say we need you. So we've learned in our first show that, of course, there is a great demand, and it's nothing our audience doesn't know because they need medical help and they know it's hard to find. Personally, I know that our director, everybody knows that. I mean, knows that. But why? What are the challenges, Melissa and Jerry? And let's start with the one that we are number one in the oldest and number one in the fewest physicians under the age of 40. Why does that happen? We have a medical school here at UNM. What's going on with that aspect? We've got a lot of other issues that we're going to deal with, but why no young doctors are here?
I think it's the healthcare economy and the way practices work. We were speaking about endocrinology a little bit, and
which is that? What is that?
We have a big problem with diabetes in New Mexico, and it's been a while since I've looked at it, but it used to be that the typical panel of patients that an endocrinologist would have would be about 75. 75 patients.
Okay, wow. Okay, wow.
But it's been some years since I looked at it, but we have so few endocrinologists in the state that they have huge panels of patients, in the hundreds of patients. And so what we've seen in that particular discipline is that the earning potential is not that high, and that endocrinologists tend to leave the state after practicing here, say 3 to 5 years.
Because I would think with the hunt over 75 panels, 75 patients, now they have 200, that they'd be earning more.
We have this little problem called poverty. And so I'm sure you've heard that roughly half of the New Mexico population is on Medicaid. And so, and then an additional high proportion of people on Medicare. And so those are the lowest paying insurers, if you will. And so physicians and others have to see a lot of patients in order to be able to make it financially.
Okay, that's it. End of show. We know now. We now know, of course. Over half our population's on Medicaid, and then we have the Medicare, and they pay the lowest. So the young doctors looking out of medical school, where to reside? So why would they come, I guess, to New Mexico?
Well,
I mean, looking at that challenge.
yeah, I think
okay.
I promised not to make it too complicated.
No,
But-
no, not. But now I think you just kind of answered a lot of it right now,
yeah.
which I forgot about. That
Yeah.
we are poor, they're not being paid, and if they have choices, the young people would perhaps choose New Mexico.
And residency training for physicians is the key. It's not medical school. Medical students don't go to work. They have from either 3 to 11 more years for high specialty physicians to complete after medical school. And there is a very complicated system nationally that to say, let's say Melissa from San Patricio wants to go to UNM for her residency. She may not be able to do that because there is a computer-based system that matches fourth-year medical students with the training programs. So UNM has little choice over which residents come to New Mexico. The likelihood of somebody who is from California, say, staying here is relatively small. They're going to go back to California more than likely. Because that's where they're from, that's where their family is, that's where their community is. Physicians are very community oriented.
So part of it's that complicated system with the computer putting the residency for the young people, but we do have a medical school. I mean, we have a medical school.
We have a good one.
We have a good one. Mm-hmm. So why don't we have young doctors?
Because they don't get the choice to stay here.
They may be sent somewhere else,
Right.
but don't
they may go to Orlando and fall in love.
But then, yeah, they would fall in love in Orlando, but not come back here. Okay.
Correct. It gets
But
a
the
little
Californians,
complicated.
of course, would always go back. I understand that. But so that's one reason. And you explained the elderly doctors because they want to stay in their profession, but it's the young ones that we need to be coming here.
Correct. And that's true of every state, by the way. It's true. The same system exists for every single state.
There was a challenge, of course, retaining doctors, but one bit of hope is the Conrad 30 J1 visa waiver program. Melissa, do you know much about that program?
We do. As a matter of fact, New Mexico Health Resources, I was very young in my career when that program was started. Dr. Harrison and others formed a committee and they got that going. Like I said, I was very young. But it's a wonderful program. There is a pool of doctors that are practicing. If they go to medical school in their home country, then they want to come here. They have to do a residency program here. Otherwise, they have to go back. That's why it's called the Conrad waiver. They have to go back to their home country unless they, how does it, I'm sorry, I think I'm confusing the program. I'm not explaining it well.
You are correct. There's a requirement of international medical graduates that the waiver is that they don't have to go back to their home country and they can remain here and practice, and they commit to working for an organization for 3 years. They sign a contract and virtually all of the hospitals in New Mexico use the program. The private practices use the program. It's really interesting in that it's an employer-driven program. They use organizations like ours to find international graduates, and New Mexico is really a leader in that we get 30 physicians a year to come and practice in New Mexico as a result of that program.
And the advantage to them is that because of the waiver, they get to stay here?
They get to stay here.
They have to commit to
3 years. Okay,
Right.
but of course they get paid, they'd be paid anywhere, but the commitment is, or the advantage to them is they get to stay in the United States.
And they can choose to be on a visa that allows them to stay for 6 years. They can choose to apply for permanent residency if they want to stay here and maintain their citizenship in another country, or they can apply for citizenship. And almost all of them do the latter.
And stay.
And stay.
Well, they have to stay 3 years, but then they might
Right.
leave
But
New
today
Mexico.
we have 90 physicians that we know are obligated to stay here at least through the termination of their 3-year obligations.
You're telling me a little bit about the country of India.
That's where we find the most physicians that participate in this program, that employers find. And it's a little bit of a consequence of the country of India opening up a lot of medical schools in the past and following the traditional immigrant path, in the sense that when immigrants come to this country, if you look at the history, they send money back home to support their families. They may eventually bring their families over, but it was a decision that India made some years ago.
Meaning that if they educated their population, become medical professionals, go to the United States or abroad, come here, earn more money than they could back home, that the residents here would send money back home and enrich their country.
Yeah. The international medical graduates, the bulk of them come from India that come to New Mexico, but it's all countries across the world.
What about the Caribbean? I thought there's some medical schools I've heard about in Caribbean, or maybe in the sitcoms talking about, oh, I got their medical degree in Jamaica, and they're...
Oh, that's a reality. Even for American citizens attend what are called Caribbean model schools. If you go to Aruba, when you get off of your airplane and you go through customs, the first thing you see is a medical school that is oriented to training U.S. citizens.
Okay. What other challenges have you seen through the years that our state kind of puts up roadblocks? I was saying a lot of bureaucracy, a lot of red tape. And regarding licensure, that's always a problem too. We might not have a reciprocity, but I think that has changed through the years. It was a roadblock before people coming to our state to practice medicine.
It is a challenge as far as licensing. It's just a long process. And that's something New Mexico Health Resources does not get involved in. The hiring entity has to do all the credentialing. We'll make sure that their license is in good standing, but that's pretty much as far as we go. We don't do any of the credentialing, like I said. The hiring facility has to do that.
You make sure their license and their home state is good.
We try to do that.
Yeah.
Okay,
Yeah.
but then I thought that was a roadblock for them to practice here.
Well,
But it's up to...
the roadblock is not so much licensing. It's something called credentialing. And in essence, a hiring organization has to prove to accreditation and legal standards that, say they recruit me, that I am qualified, that I don't have any severe patient harm that I've done. Licensing has really improved since COVID. And there was an executive order, I believe, that held all of the licensing boards to process things very, very quickly. I've not heard complaints about licensing for a long time.
Regarding, well, the credentialing then, to see if they had problems back home, I thought, and I think New Mexico is working on tort reform for medical professionals here in the state of New Mexico, because there can be huge judgments against doctors that our state allows, a huge judgment. And because of that, some doctors and nurses and other medical professionals say, oh, I don't want to have to put up with that. I don't want to have to take that risk. And then, of course, their premiums could be high. What can you share about that, doctor?
It's a severe problem for private practice in New Mexico, a very severe problem. I have a daughter-in-law who's a physician, an OB, and I think I recall that she told me that she had to cover $83,000 of liability insurance last year. That's a lot of money, and that has to be earned. And it's an issue, particularly for private practice. The statute was changed in 2021 to, from my distant point of view, allow for higher awards to be made than the former statute
To
allowed.
allow for more, higher
Correct.
awards against a private physician or any physician.
And it
or-
hits hospitals
Sure.
as well as
So that's a
private
discouraging reason for people, practicing physicians, to come to the state.
Yeah, if you are responsible for earning the money that covers that, absolutely, and then running the risk of having an award against you, or I don't know if you watch television. Oh, you used to be on television. Watch an afternoon show here in Albuquerque, and how many attorneys are supporting.
Oh, the TV stations,
the
the,
TV
the trial
stations.
lawyers.
It's,
Trial lawyers are on TV all the time. Okay.
And where do they look? Who do they look at to be able to pay the awards that they might get?
Incredible. That's something tough. Actually, thinking of that, my primary care physician was an obstetrician years ago, and she stopped the practice, I'm saying 30 years ago, 25 years ago, to become a cosmetic surgeon instead of obstetrician because of the liability of being sued.
Yeah, and it's a very serious issue.
What are the other roadblocks?
I think as I do my traveling, I travel across the country to various job fairs and conferences, and some of the top questions that I'm asked as people come to my table, wondering, what is the pay? What is the pay in New Mexico?
And you say pay? Oh, we pay people?
And it varies because we work with so many different types of organizations that the pay and benefits can vary from a private to
That's the
big
first
hospital.
question.
That's
Okay.
Usually the first question, not always.
So,
they want to know if
But I mean, what the pay, when they find that out, they say, thank you very much, Melissa, I'm going to the next table?
sometimes. And it,
Truly?
yeah, and I
So
don't,
what do you
don't-
mean, what is the pay?
We don't like to quote salaries because it depends on the experience, the discipline. So, we might give an average. That's about what I can do.
Can you tell us what that is?
Jerry just conducted a survey.
Well, a typical primary care physician across the country to start would be making in excess of $300,000 a year. It's very rare that any new graduate, which we concentrate on, the reality, is going to have the ability to find a position that pays that much money.
But when you say 300,000, but they have to pay for their office space, they have to pay for their...
In private practice they do,
Right,
but
right.
not necessarily if they're
Okay,
employed physicians.
but that would be a number Melissa would say, an average salary is 300,000, or you said a beginning salary
a beginning salary nationally, but not here.
is 300,000.
Correct.
What about here in New Mexico?
A huge range from roughly 195,000 to 280 would be the range. And one of the more interesting things is a rural primary care practitioner may earn more money than an urban physician starting out
Primary practice.
in primary practice.
Well, that would
yes.
be an attraction.
Yes, it would, and it is.
What's another question that they ask?
Another question they ask is, what is the call schedule? They want to know if they're going to have a life outside of work. So they want to know what the work balance is. What is my call schedule going to be like? What is the school systems like if they've got family? Not a lot of them.
Hey, what do you say about the school system? I mean, we've heard about all businesses turn their
I
nose
say
up
it's,
at New Mexico.
I think
because-
every state has issues with the school system. I won't say, oh, New Mexico has bad schools. I think everybody does. I mean,
When we deal with our colleagues across the country, we see the same list of issues. School systems
Crime.
are right there.
Crime? Is that ever a
Crime
question?
is everywhere.
Right,
Crime
but
is
do they ask
everywhere.
that question? Do they?
they don't usually ask me.
Usually ask
I think they Google themselves
Yeah.
and they figure
go
it
to
out.
the news media for that. And we have good reporting.
Yeah, when they call the National Guard up in Albuquerque, hits the news across the country. Anything else that needs to be
A
fixed?
lot of, well, another question that they might ask me is if there's loan repayment. New Mexico has a very good list of financial incentive programs, I feel, to offer to health
And one of
professionals.
the big steps that was made 2 years ago was that the legislature increased the award for loan repayment to $100,000 over 3 years, which is renewable. And so people now are able to get their entire debt paid off. We see some astounding levels of debt. Dentists may have between $500,000 and $700,000 of debt. Physicians are usually in the $300,000 to $400,000
We help them pay that out.
level, and even mid-levels.
To find more information about New Mexico Health Resources, Dr. Jerry Harrison and Melissa Candelaria, thank you for being part of these programs. Where should they find more information?
You can go to our website at nmhr.org.
Very good. And you're hopeful
Absolutely.
There's hope.
because
It's been improved in the past when there were previous crises.
but we're in a crisis now.
And people in New Mexico get together and try to figure out the answers for their communities.
And hopefully the legislature is part of that answer. And the voters are part of that answer. We are all part of the answer. Thanks for watching the program. We'll see you next time. Bye-bye.
Issues and Answers with your host Diane Kinderwater is presented as a public service to inform, educate, and better the lives of New Mexicans. To comment on today's program, email us at info@kchftv.org or call us at 505-345-1991. Join us again for Issues and Answers with Diane Kinderwater.